Welcome to the Point of Medicine podcast, brought to you by LearnNeuralTherapy.com. Doctors Ann Hill and Alana Gurvich team up to take a deep dive into the art and science of healing. This podcast explores cutting-edge approaches to the autonomic nervous system and its role in organizing fascia for optimal health. Each episode features conversations with leading clinicians who are pushing the boundaries of medicine, uncovering new insights, and transforming patient care. Join us as we bridge tradition and innovation to expand what's possible in modern healing. Just a reminder, this podcast is for educational and entertainment purposes only and not intended as medical advice. Please consult your healthcare provider before making any changes to your healthcare plan. Join us and let's jump into the next episode.
Hi, everybody. We are here with Dr. Karl Anderson, and Dr. Anderson is a dentist are you in Minneapolis, Karl?
St. Paul, actually.
St. Paul. He is a dentist in St. Paul from, close to my hometown, which is Minneapolis. Karl, we're really excited to interview you. We wanted to get some dentists who do neural therapy because it's such a great thing to be able to do in the dental population. And so we're excited to talk to you about that today. And then also you have been on the board, the NAANT board. You've served time on the board. I don't know if you're still on the board, but you'll tell us a little bit more about that. And then, and you've done different trainings for neural therapists and spoken at conferences. So everybody always enjoys you because you are a great speaker. So Karl, why don't you tell us a little bit about why don't you tell us a little bit about the antlers on the wall behind it? No, just kidding. Why don't you tell us a little bit about your credentials?
Shot him at 300 yards.
Okay.
One shot.
Tell us a little bit about your credentials and how you got into doing dentistry and how you started weaving neural therapy into that. That's a lot of questions. Sorry.
Yeah. Well, first of all, okay. I was a very young father, didn't have any money. Went to school, college. I was born on the east side of St. Paul, where the men are men and the women are too. And if you're from Minneapolis, maybe you don't know the east side, but it's almost like a small town. Everybody knows each other. I grew up with mostly bikers and other people on the Lower East Side. But I was 17 years old. I had a son on the way. I had to figure out way to make money. Okay, I was working as a carpenter, but I thought, I have to get educated. And so I started college and ended up getting into dental school a year early, which to me was just a year early bonus. I could make money quicker if I got into dental school as opposed to medical school. As either one of those two would have been okay with me. But I got into dental school. My dad was a dentist, and so I grew up in a dentist household, but I had left my dad's house when I was 17. And so my son was born. I got married, got my first car, got my first real job, and signed up for college all in the same weekend. That weekend I turned 18. And so it was a struggle, but I went to dental school and graduated in 1981 as a general dentist. I was allopathically trained for maybe some people that don't know what allopathy is. Your normal dentist is trained that way too, like most doctors. But I always, sort of was skeptical of the things that I was taught. I was taught never to call amalgam filling a mercury filling. Call it a silver filling. It's a silver filling. And once the silver's in there and the mercury goes in there, it never comes out. I was taught all these things that were they weren't true. And I knew they weren't true. But, I had to go to the plant and do the deal and get the degree, and I did. And I got out and started practicing. I practiced in the Caribbean for a period of time. In 85 and 86, after I got done, I went to school and went on to get a degree in periodontics. So I'm also a periodontist. But once I got done with that master's thesis and defending that, I said, okay, I need a break. A friend had an uncle that left a practice down in Antigua. And so I put my family on a plane and we went to Antigua. So actually, I'm the first white dentist ever licensed in the history of Antigua. I don't know if there's any white dentists yet to this day, but I was the first. And I practiced in Antigua for a couple of years off and on, and we'll go down during the winters and do surgery and come back and practice in a couple practices up north here in the Minneapolis area, St. Paul area. Now, but again, I lifted my limitation ultimately, so I went back to doing general dentistry because I bought my dad's practice out. He and I became friends after a period of time, and I bought my dad's practice from him, and it was a very large general practice, and started a practice called sedation implant dentistry. I was very early in the implant game, and so I could probably say at this point maybe I've replaced 90,000 titanium implants over a period of time. Since then, that has evolved because of the more naturopathic approach. I do more ceramic implants. I was very early in that field. And so I think it was, what was it? Oh, it was my own struggle, actually. I think a lot of us end up in this field because of our own struggles, but I was diagnosed over 12 years ago with Alzheimer's, early onset Alzheimer's. My mother died of it. All my aunts died of it. My sister's dying of it right now. And I went to a doc, and he said, well, you have the EPO34 gene, blah, blah, blah. You're already exhibiting memory loss and this thing and that thing. You have early onset Alzheimer's. You're going to be prepared. You're going to be in a nursing home by the time you're 68. Well, I passed 68 a while ago, so I'm not in a nursing home yet. But that started me studying functional medicine, only for my own self-preservation. But the more I studied functional medicine and I started getting introduced to naturopathic medicine, I thought, wow, I never even knew about these fields of practice. And so I signed up for Phil Mullica's school out in New Jersey, which is it's abbreviated sort of naturopathic school, but it exposed me to homeopathy, exposed me to neurotherapy. That's where I met your father, Lana. And anybody that knows your father knows him to be one of the most gentle and kind, I mean, truly caring human being, and love him dearly. And I immediately connected with him. And of course, he connected with me because I'm a little bit of a psychiatric case. I'm a recovering alcoholic and addict, and you recognize that fairly quickly. And I've had a lot of trauma in my life, and so I have PTSD and blah, 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 blah. But in either case, so we became really good friends. And when they were talking about putting together this North American Academy of Neurotherapy, I mean, put your money where your mouth is. And I became a founding member at that, and that was first for me. And so I started going to all your father's seminars and any seminars that were available, started reading more and realized that, there is in dentistry a way that I could help people with neurotherapy. Although, to be honest, I probably only do neurotherapy 3 or 4 times a week. On a lot of my patients, I might inject their tonsils or might do lymphadenopathy drainage. Some of the ganglion shots I'm a little uncomfortable with yet, or I've done them, but I don't feel versed with them a lot. I've done the crown of thorns. I've done some other neurotherapies that have helped my patients tremendously. Probably the biggest thing is tonsils, because people don't realize that we're harboring so many biofilms back in the tonsil region. And so, but my whole practice changed. I could no longer sit and tell a person they should get that root canal, because all root canals are low-grade infections. They are harboring bacteria at the apex. So I could no longer stand by and say, hey, these amalgam fillings are okay. Maybe you should consider removing them safely. And I have a great story about that one here. It just happened today. Cavitations, holes in the jawbone where teeth did not heal. That bone is harboring bacteria. And so what happened was a lot of doctors found out about me locally. Jeff Katowski, Elise Hamilton, a lot of practitioners in the town that are doing alternative therapies for cancer. And I happened to be the only dentist at that time that would go ahead and accept those referrals and then screen them for toxicity in their mouth and start safely removing that toxicity. So that's basically what I do on a daily basis every day.
So the toxicity that you're mainly finding in the mouth is amalgam or mercury based, or you're also finding a lot of cavitations?
I would say that's pretty secondary. Amalgams can be very devastating for certain people. And for instance, I treated the mother for cavitations in a bad tooth that was abscessed. She wanted me to remove it safely, and I treated cavitation on her today. I met her 2 sons. One is normal and one is severely autistic. And I said, well, I started asking about the autism. And she said, yeah, I didn't know, African American. I didn't know, but he went autistic right after his vaccinations. And so, we've been struggling with this, and I've done a lot of research on it. That's why we chose to come to you. And I said, well, he's got mercury fillings in his mouth. I mean, you knew that, right? And she says, well, I specifically requested not to have mercury fillings put in his mouth, but the dentist saw him and said, oh, that's the best filling material, and put him in anyway. And I said, well, that didn't help with his autism, I don't believe. We could safely remove these and see if we could have some improvement. And he actually saw one of my associate dentists that does also this kind of work. In fact, he's in that school at Phil Mullica's, and runs up in New Jersey right now. And so he saw Jack, and Jack removed some of his mercury fillings. I don't know if it's the last one they removed, but we got his mercury fillings out of his mouth, and now he's starting to communicate. He's 21 years old. He never talked. Now he's talking. I saw him in the waiting room. I waved to him. He waved to me. smiled. I went out and, gave him a high five when I got done with his mom. I mean, he's actually communicating with his brother. He never spoke to his brother. He was afraid of his brother. He was like paranoid of him or something. We're already seeing, and of course, I mean, I got her using some biotoxin binders and some other things to after the procedure. And when we're doing the procedure, I know that he wasn't re-exposed, but I assume that he's probably got mercury toxicity. And so she's doing some things with some IV therapies and other things to help him. But it was like night and day difference, she says, once that mercury came out of his mouth. So there's a case where we see it quite often. Interestingly, I see it a lot in Minneapolis. We have a lot of Somalis, and I don't know what it is genetically or whatever, but I don't think they can handle mercury, which maybe makes sense because in that part of the world, I mean, they weren't exposed to a lot of that prior. And so maybe they don't have the detox mechanisms to handle it. I'm not sure what the cause is. Or when they come to the United States as an immigrant, bam, 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 bam. Every one of these kids are getting all the vaccines all at one time. But there's a real huge population of Somalis with autistic children also. So that's where mercury is. But I would say the majority of toxicity I remove is cavitations and root canal teeth that I can find a reabscess formation on, which is almost always.
How are you screening for the cavitations or the reabscess?
I'm still using I'm using a cone beam CAT scan. There is some technology in Germany. I paid for a machine, but I still haven't received it yet, called the Cavitao. I've got to follow up with that because I'm really starting to get concerned that I paid money 2 years ago. And I don't know if they were saying that the FDA has to approve it yet for screening in the United States, but Germans are using a machine called Cavitao. And Dr. Leshner and his group are really doing a lot of research on it and have proven that it's a very effective screening tool also. I have a lot of patients that get screened when they're doing, thermography instead of a mammogram, for women. And so the gals that do thermography see this, you always see these hot spots in the face. You see it coming down their lymph node chain, draining right down into their breast.
That's how a cavitation will present with thermography. You see the hot spots in the mouth and the hot spots down the lymphatic chain?
Yeah, and so they'll send them to me for a screen. Legally, I mean, you can do muscle testing, all that stuff, but that doesn't stand up in a court of law. So I'm obligated to keep my license. I have to be careful a little bit. And so I use the cone beam CAT scan as my main primary tool for screening this.
And you feel like it finds it 50%, 70%, 90% of the time?
Oh, I would say 90% of the time.
90% of the time. Okay.
If you're looking for it. I have sent in, I mean, I have people that go, well, I want to send it to Beam Readers, which is a company that reads a cone beam CAT scan. And they'll say stuff like hypodense bone in the wisdom tooth area. Well, that's
very innocuous.
That's a cavitation,
Right.
And so, radiology in the United States is allopathic, and they're trained allopathically. So if they don't, I was taught in school, I was never taught there was such a thing as cavitation.
Mm-hmm.
But being an implantologist, I would come across them all the time. I go to put it, it looks okay on a 2D X-ray, and it looks okay to me, and I go put an implant in and drop into a hole. Look down in the hole. What the hell is that? I didn't know what I was looking at until I went to Phil's school and realized those things were called cavitations.
So that's when you learned about cavitations. It's not in the standard general dentistry world.
No. And I've been in front of the board about every 3 months. I got to go in front of the board and explain why I told the patient they had cavitations, or why I said that mercury-based fillings within their mouth, and maybe they might want to get those out. I don't tell anybody they have to do anything, but I give them, they're coming to me to be screened for toxicity, and I'm just telling them, number one, biomaterials. I mean, there might be other biomaterials that a patient's incompatible with. I could put a crown. Sorry, there's some workers in my building right now. I could put a crown in on you, which is zirconia, and it's just fine on Alana, but I put it on Anne, and all of a sudden it's not working for Anne. She's like, ever since that crown went in, there's a problem. And so not everybody can handle all the materials. So there's screening tools, there's blood screening tools. That's where you can do muscle testing a little bit, because it's not, you can get a little better idea with biomaterials. But safe biomaterials. And certainly when a silver filling shouldn't be called a silver filling. You don't call a gold crown. A gold crown is not 100% gold. A gold crown is mostly gold, right? That's normal. Or apple juice is mostly apple juice. But it's got water, it's got sugar, it's got other things, right? We call it apple juice. Well, how about a silver filling? Is it a silver filling? No, the main ingredient is mercury, right?
Yeah.
And so it should be called a mercury filling by standard nomenclature. Never use the word mercury. I was taught that in school. But I was also in school, when I was in school, we were playing with it. And by the time I got done with school, 3 or 4 of my classmates committed suicide. And a bunch of them got multiple sclerosis right away. And so I would have to say they were probably suffering from mercury toxicity because it was before gloves when I graduated. We would squeeze the excess mercury out and it would drop onto the table. And we would take our fingers and push it together and send it across. Whoa, we weren't taught safety on mercury. So
Did
you
you go to
imagine
the
how
University of
toxic
Minnesota dental school?
yeah, you can imagine how toxic the University of Minnesota was in the operatory clinics. My gosh, it's crazy. But, we didn't wear masks back then. And so I've had to go before the board. Well, is this the dentistry you learned in dental school? I go, okay, I'm done. We're done. And, well, I'm not done to question you. I said, well, I'm done answering your questions. I said, that's the most stupid question I ever heard in my life. Well, what are you saying? I said, listen, you were 2 years behind me in school. Well, you remember when all of a sudden we had to wear masks with the advent of HIV, right? All of a sudden we had to wear rubber gloves. So we weren't doing that in your first couple of years of school. And I wasn't doing it either. And I said, we didn't have computers. We didn't have CAD/CAM. We didn't have cold beam. We didn't have access to all this stuff we have now. That's what's called continuing education. Of course, I'm not practicing dentistry like I learned in dental school. My God.
So
And so I
how
got up and left.
when do you think there's value in looking at the ganglions or looking at injecting the lymphatic chain or pushing detox in that way when you're removing toxicity from the body?
Well, I think I try to convince people. Well, first of all, if I get done with somebody, I'm already shooting I just automatically going to shoot their tonsils because it's going back to it. And
For any
so,
procedure you do, you're generally going to try to
well,
inject
any
it.
detox
Any
procedure I'm
detox
doing,
procedure. Huh,
if
interesting.
they're not having any problems, I'm not going to be doing those kind of things. But I tend to see a lot of people with those problems.
Yeah.
And so those are the patients I'm seeing on a daily basis. And, traditional dentistry, occasionally I'll do a crown on a patient or a bridge or something like that, normal traditional dentistry. But those people aren't the people that are coming in because of toxicity. And I try to pick the most non-toxic materials that we have. And so it's sort of a challenge. And I mean, it's a real challenge now because they're claiming that there's nanoparticles in most of the anesthetics. So I'm using Ortec, I believe Ortec is one specific acceptocane that has been tested that they say there is no nanoparticles in it. I don't know, 100%.
Yeah. What's the material you're most commonly doing implants with right now, and why?
Zirconia.
Zirconia.
Primarily, metal. I've done a lot of titanium implants, and many of the cases I did 4 years ago are still fine. But about 15 years ago, we started seeing what's called peri-implantitis. Now, I told you I'm a periodontist, so when we started seeing peri-implantitis, and everybody assumed, well, it's bacterial, and we started treating it as if it's a bacterial infection. Well, some would get better and some wouldn't, and you go, wait a minute, I don't think this is bacterial, And so started doing a lot more research on it, and started in Europe. They have done a lot of research on it, but the problem with titanium is that it is a metal, okay? And metal corrodes, pure and simple. All metal corrodes, and even titanium corrodes. And so what ultimately can happen is a macrophage picks up a ion of titanium. Now it brings it back to a lymph node, and pretty soon you've got autoimmunity to your titanium implant. And so you start seeing this phenomenon of rapid bone loss on a titanium implant that doesn't correlate with bad oral hygiene. It's not totally bacterial. And so I started seeing this. I've had discussions with some of the biggest. I'm friends with the biggest implantologists in the world. I mean, I was really good friends with Carl Misch. He passed away, but what was his name down in Florida? Jack Krausen. I said, Jocko, you know darn well, 30 years ago, you could drop a dental implant on the floor, blow it off, put it in a patient's jaw, and that thing integrated, and there was no problem. Now you're starting to see 25% peri-implantitis. Where's this coming from?
What was the material back then?
Titanium.
Titanium.
Yeah.
I said, what's going on? What happened? What changed? She says, well, that's, now you say that, it's true. I mean, I don't know what I would say. I said, well, you have to think about it a little bit. Either the host has changed.
Which it has.
Yeah. Material isn't the same material, or the body can't handle that material for some reason. Then I started looking at deodorant. titanium oxide in the deodorant. I started looking at juicy fruit gum, titanium oxide in juicy fruit gum. I started going, wait, maybe we're sensitizing the body to titanium. And then you do have corrosion anyway. And so when the ceramic implants weren't strong enough in the beginning, they've been in Europe for about 15 years, but in the last maybe about 8 years, I guess, I've been using titanium. Now, it's a different beast in a sense, because when you put in zirconia implants, it's bioinert, and the body does not respond to that zirconia. When you put in titanium, the body responds to it, and the bone heals with a process called osteosclerotic bone. But, Anne, would you consider osteosclerotic bone healthy bone? No, it's osteosclerotic, right? It's like a fracture, and that fracture heals, and you get the callus, but that healed bone isn't the same as the regular bone, right? And so maybe when, they say, I get better results with titanium. Well, yeah, because it will sclerose and it will be in there, but are you going to have long-term better results? And then you look at, like a meridian chart. This is a standard meridian chart according to Bohl. Most people can look that up on the internet. A meridian chart, you start looking at interactions between teeth and other organ systems. I was never taught that in school either. But there's tremendous link between root canals, for instance, and cancer. I see breast cancer. Oh, I just saw one today, right on the left side breast cancer. I said, don't tell me, before I sat down, don't tell me you got a root canal up there on that tooth number 14. She says, yeah, how do you know? I said, because I see it 99% of the time. Really? I said, yeah. So we did a scan on her, and I showed her, oh, there's your recurrent abscess right there. Yeah, that tooth's got to come out, in my opinion, okay? It's connected to your left breast meridian. She says, well, I was doing fine. I did traditional therapy, chemotherapy, and everything else. I was in remission for a couple of years, and then all of a sudden it's back again. I said, well, it's because maybe you didn't get rid of the cause to begin with. Maybe. I don't know. You also have some cavitations. Now, cavitations, the bacteria that are involved in cavitations, the same bacteria that's involved in gum disease, the same bacteria that's at the apex of every root canal tooth. That bacteria, the two main ones are Fusobacterium and P. gingivalis, right? You've heard now that in England they're saying that P. gingivalis is the cause of Alzheimer's. Isn't that interesting? What's an oral bacteria doing up in the brain? Well, if it's on certain meridians, it's going to travel to the brain. If it's on certain meridians, it's going to travel to the breast. Quite frequently. Not 100%.
So let's just, so this patient, right, the one with the damaged tooth, you would extract the tooth, and then do you think she's a good candidate for an implant, or would you let it just hang out?
Well, we got to get her. We got to get her back into remission.
So you would extract the tooth, wait for her to get back into remission.
She's seen my doctor, my personal doctor is Elise Hamilton. Elise Hamilton's a non-traditional MD. That's always in front of the bone. But Elise treats a lot of cancer with IV therapies and ozone therapy, IV ozone and 10 pass, and, some of their therapies can be utilized for cancer. And so she's seen Elise Hamilton, although she did tell me that she said on Monday she was seeing her oncologist. And on Tuesday, she's following up with Elise Hamilton. And I said, well, and so we treated her today on her toxicity on the left side. Or we didn't treat her today, we treat blinded today. But I said, be careful when you talk to an oncologist. He's going to tell you that that's all nonsense and don't do it. Wait till you have your conversation with Elise Hamilton, because she's come to me and had teeth removed that were on the breast meridian. And, you can follow these things with thermography. It's unbelievable. All the hyperthermia just goes away after you get rid of the toxicity in the mouth. But that's where neurotherapy is such an excellent therapy. You can use it to put into the tonsils. It's anti-inflammatory. It helps reset obviously the nerve tissue back there. But it also when I do neurotherapy, quite often I'm following with ozone.
That was
I'm doing an injection of ozone at the same time. So it's very rarely that I won't use both.
Are you using neural or ozone in the cavitation?
I have not. Well, we use a lot of ozone, percolate that down into the hole once we clean the hole out. But the only way to deal with
liquid or with gas or both?
Gas or liquid ozone water to flush it once I'm cleaning and scraping it out. You got to get that unformed bone and bacteria and the overload out of there, in my opinion.
And you suction that out.
Yeah, there are a lot of what do you call naturopathic dentists or holistic dentists that say, well, I can just inject ozone into that cavitation and I'll heal your cavitation. I've done that thousands of times. I've never seen it heal a cavitation. I've seen it. I know it's reducing the body burden of bacteria that are in that cavitation, but I personally believe it's better to surgically excise go in and clean it up.
And you're doing that with a vacuum? I'm sorry, with a laser? You're doing that just extraction,
I've
like
got the laser. I haven't seen any better results with the photona laser, but everybody that gets a photona laser thinks that it'll do magical things. No, you just clean the bacteria out. I think what's doing the magical things is, number one, the first question is, are you supplementing with vitamin D3?
Mm-hmm. Why?
Yeah, I want them up in the 80 range if I'm going to do surgery on them, right? Because they're going to drop 25% day of surgery. If they're in the 30 range or 40 range, they're going to drop below that. They're not going to heal more. But number one, that's number one. Number two, when I go in and clean it, I debride it, flow, and that's where a photona is. It's a good tool for maybe cleaning it out and debriding it. But you can do that with a hand instrument too and debride it pretty well. But then flush it with ozonated water. Then I percolate ozone gas in there, 20 mics per milliliter. And then I go ahead and I use platelet tribun as the secret sauce I put in there. I was on the International Association of Oral Medicine and Toxicology did a position white paper that I was involved in rewriting. It hadn't been rewritten since 2014. And we thought, wow, there should be a lot of literature out there since 2014. And there really wasn't much good literature out there since 2014. It was mostly anecdotal. Some people sprinkle pixie dust. I call it pixie dust. They throw a little melatonin in there, and that's going to be the magic secret sauce. But there's no evidence of it. Same with the laser.
In your experience, if you properly clean it and debride it, and it's taken care of, you find that it does not reform cavitations?
We get about 90%.
90% on that.
Yeah, maybe a little higher. The Germans research and what Germans have been doing for a long time, they've been treating us a lot longer than us. Hans Lechner said that they used to they had less than 50-50 on treating cavitations, less than 50% healing on it. But that was before I think we started implementing ozones. We started putting in plate-rich fiber. Okay. So I think we're getting a little bit better result than that. We follow up ours. They come in 4 months later, 5 months later, and we rescan, and then we remeasure and see. And occasionally they'll see just one little spot, compared to it was one big area before. Now it's one little spot. On that person, Ann, is where I would go in and inject ozone 4 or 5 times, usually a week or two apart. Put it in with a little cannula called the X-tip. Drills in after you numb the tissue and drill it in, and then you can put the needle through the cannula and put it right in the bone. And that's where I'll percolate in the ozone gas and usually clear up those little spots if there is a little spot in there. Okay.
That's really good that you're following up, because a lot of the dentists don't seem to follow up with cavitation.
No. I mean, some dentists specialize in, because people are coming in from all over the areas, out state, whatever. Stuart Nunnally is a good friend of mine. Stuart Nunnally is down in Red Rock, Texas, and he and a couple guys wrote the first position paper on cavitations. And so Stuart's very busy, and a lot of people don't come from all over the place to see Stuart. But yet, unfortunately, they don't follow up. And there's where my son, maybe it's my fast. But in either case, he's retired now, but he was out in Arizona. And the reason he'd retired is because of the board. I mean, you're really at high risk doing this kind of stuff. The boards are after us all the time. Like I say, about once a quarter, I usually get a complaint. The board is obligated to protect the public, so that, it's not that it's their fault. They get a complaint about, but I called the executive director of the board because it's my daughter. But if my name comes across her desk, she has to recluse herself. What the hell? They don't do that in the government. I mean, come on, really? You got to recluse yourself? Come on, Bridget. I mean, and finally I got somebody within the Communist Party, and I can't even have it in with the party. And she goes, "No, Dad, I'm sorry, man, but I'm very ethical and I have to recluse myself." And so it goes to the rest of the board members. And so I have to go through this about once a quarter. But what Bridget did do, which was smart, my daughter Bridget, is she got Mark Ruskowski, an oral surgeon, on the board. Okay. And I helped Mark get through that course that we talked about at Phil's. I gave him the test questions for the final test. And so we're good friends. And so he understands all this stuff. He does the same kind of work on a daily basis. So I think that's going to sort of stop my problem that I have had with the board, but it is that way. I mean, I don't know if you guys ever heard of this book by Thomas Levy.
It's called The Hidden Epidemic.
Yeah. I'd recommend that book to anybody. It
And
says,
that talks about all of the biological factors that can cause damage or toxicity?
yeah, he doesn't talk about the mercury aspect too much, but he talks about root canals and cavitations extensively, and it's linked to other diseases. Okay? I mean, he has a whole chapter on chronic apical periodontitis and heart disease, periodontitis, and pancreatitis, breast cancer, colon cancer, head and neck cancer, esophageal cancer, lung cancer, Alzheimer's, Parkinson's, other neurological disorders, all cause mortality, metabolic syndrome, hypertension,
So,
cerebrovascular.
Karl, how are you, when you're removing amalgams, what's the protocol that you feel like most clinicians should be following to be
Well,
offering the safest results for
yeah.
patients?
Yeah, well, there's two associations that are involved in this kind of stuff in dentistry. One is the International Association of Biological Dental Medicine. In fact, I'll be at a conference, and in fact, I'll be hanging out with this guy. He owes me a little bit because I give every consultation, the patient gets this book. So I bought 3,000 of his books, okay? I think Tom owes me a steak dinner. But anyway, Tom's own history, he's done a cardiac disease. He's a board certified cardiologist, and he's a lawyer. And when he tried to write this book, the government did come after him. He says, well, I hope you know I'm a lawyer, too. And I'm very well cited with literature in the back of this book. I know my stuff really well. He says, please, I want my day in court. I want to go to court. I want to be able to state this out in record. And, of course, the government backed off and the book came out. But the point with these patients is that you have to educate them. You have to inform them. Let's say you went to a dentist. He says, well, Ann, you've got an abscessed tooth here. We've got to save this tooth, and we're going to do a root canal. And I have 90% success with my root canals. Okay. Question might be, well, okay, what does that success mean? To an endodontist, it means it doesn't hurt. Cancer doesn't hurt until it's quite advanced, right? It doesn't mean it's healthy. And how can you possibly disinfect miles and miles and miles and miles and miles of microtubules? Well, I got a Fatona laser. Well, I got one too, $120,000. And guess what it does? It cleans within about 1 millimeter into the tubule. And there's 3 or 4 other millimeters that are stuffed full of bacteria. And even if you could disinfect and you sealed it, then what would you do? Well, what do you mean? What's there to do? You put a crown on it. And so now you're up to about $4,000 or $5,000 to save that tooth at no matter what cost. It's always got a chronic infection at the apex of it. Now, what prevents bacteria from migrating in from the outside into those microtubules, which makes up the root? Because the root is nothing but miles and miles of dental microtubules. There's nothing that prevents that. It's all in the literature. It's there. There's nothing that prevents that. So a tooth is nothing more than I tell people, I do consults every day. I told them, it's like your kitchen sponge. You've all used one, right? What do? You rinse it out, squeegee it, soap it up, squeegee it, rinse it out. You throw it up on the cupboard, and it dries up. And the next time you go to use it, you moisten it and you use it and you use it. But there comes a point after about a month, man, or it depends on how much you're using it. But after about a month, take a sniff of that thing one time and you go, whoa, you cannot clean out a sponge and you can't clean out microtubules in a tooth. Okay. And so you got this chronic low-grade infection weighing on you all the time. And worse, Alana, you're chewing on it. So every time you're chewing, microscopically, it's pumping from the apex, which is where the bacteria are, into the into the jawbone. Okay. And that's got to go someplace, and it migrates accordingly, a lot of times, according to the meridian chart, unfortunately.
Okay. So if you can extract that infection, extract the root canal and clean it properly and put in ozone and put in PRF, right? PRP?
Yeah.
PRF.
Yeah.
PRF. Yeah. And you're still closing up that tooth. You're still closing up the tissue. So it's still kind of in there. Or you think the platelet-rich fibrin will manage the infection, or the ozone will manage the infection?
I believe that cleaning out and debriding the tooth and debriding the bone real well. Germans believe in taking out 1 or 2 millimeters of bone. And I don't
That's
get
painful.
that aggressive.
Yeah.
I don't get that aggressive. But I'll remove a millimeter bone quite often when I'm just extracting the tooth, because to get a tooth out, it has to become loose. You can try to wrestle with a root canal tooth, but I'll tell you what, you'll snap it off every time. Well, if the Germans are recommending removing bone anyway, then take an instrument, like you use a piezo instrument, or make even a cello burr, and just go alongside the periodontal ligament, and you're carving out a little bit around the tooth. Now the tooth can get a little wiggly, you can get it out. Then you scrape and debride the heck out of it with, the special instruments we use to do that. And you can use rotary instruments to do
What
that.
do you think the PRF is doing? What's the PRF? What's the point of the
Well,
PRF?
PRF is acting as an antimicrobial clot. Plus, in the platelet-rich fibrin layer of the platelet-rich fibrin, that layer of the actual platelet-rich fibrin, within that is a higher concentration of your own stem cells. So,
And the stem cells are going to cause the bone to regrow or the infection to get controlled?
Well, stem cells will differentiate into bone cells, but the buffy coat is called, the upper level of the platelet-rich fibrin is called the buffy coat. That's full of nutrients and bone morphogenic proteins, but it's also antimicrobial. So it occupies the site. And we put sutures over it and stuff like that, but it occupies the site with an antimicrobial clot. So it's a little better than just letting your body can heal in a lot of cases, just taking a tooth out, clean it out real well, get to bleed real well. But then what do people do when they go home? I got bad breath. They start swishing, and next thing they got a dry socket, which is called osteomyelitis. And that's really painful. Now you got bacteria infecting the side of the bone. So how do you get rid of osteomyelitis? You have to renumb the patient, then you have to clean and scrape that bone, repercolate ozone in that, So platelet-rich fibrin is a good bang for the buck. Most dentists charge for platelet-rich fibrin. And there's a lot of people that go, well, I don't want to pay that. Or they say, well, does my insurance cover it? No, insurance doesn't cover a whole lot of things that I do. And if you want what I do, I'm sorry.
Carl, what's your take on using cadaver bone? You're getting the dental.
Yeah, this is all of our greatest hits that we want to ask every dentist. And this is what people are this is what people really care about, like the dental world is so mysterious, I think, for most patients.
Or they're told, well, like you said, they're told things that are not true. It's because of what they learned in school.
Yeah.
Yeah.
Well, I think you both being naturopaths, you understand homeopathy, right?
I hope so. We both passed the board on it for sure.
Well, you understand that, basically a homeopathic preparation of this is arnica, that there's no physical arnica in there anymore. It's the energy of arnica that was put in there, right? Through succussion, past the point of Avogadro's number. Well, we can't really argue that homeopathy doesn't work. Practice for 250 years in Europe. I mean, anybody that's used homeopathy understands it works, right? Okay. And that's sort of irrefutable, although the United States government doesn't like it because they can't measure it. Okay. Can they measure energy? They don't know how. And so, but the fact of the matter is, I started thinking about it one day because you do see some really strange stuff with, I call it bottle bone, which is cadaver bone. It's bottle bone. Best bone, if you're going to use it, it should come from yourself. The only problem is to take a harvest of yourself. Now you've created a second wound. So I don't like to do that. Being trained as an implantologist, and very honest, I mean, I was using bottle bone for years. But I see these cases where, I'd re-enter and it looks like bone, but it's not bone, And there's pieces of that cadaver bone still in there 15 years later. Well, what's a piece of cadaver bone still doing in there? I was taught it dissolves in your own body. It's just acting as a scaffold. They taught us you put it in, it's just a scaffold for your own bone cell, your own cells to grow in there and grow, and that'll just dissolve and go away. No, histology is showing it doesn't go away. And then you park a dental implant in there right next to a piece of bottle bone that's, 15 years in there, lined by macrophages, right? Why is it lined by macrophages?
It's foreign substance.
Okay. Now you put an implant right next to it. Could that be part of the peri-implantitis situation? And we're talking about Jack Krauser. I said, could that be part of the peri-implantitis? It's the bone. Because in the old days, when we put an implant in, we put it where we had bone. And if we didn't have bone, we didn't put an implant in.
So what are you using?
Well, there's other alternative synthetic type materials. I've tried them all. Lately, I've been using Steiner Biological material. Steiner Biological is a TCP. It's a tricalcium phosphate, enhanced tricalcium phosphate. Synthetic. Totally disappears, goes away. I've seen some really good results with it. They're again, very technique sensitive, but I've seen some good results with it. But getting back to the homeopathy and allograft bone. If homeopathy is possible, where did they get that allograft bone?
A dead body, right?
Whose dead body? You've given up your body to get it ground up? No, it's unclaimed dead bodies. What, drug addicts, alcoholics, criminals? They're grinding that bone up. Okay. Now, granted, they're bringing it through acid. They're bringing it through an acetone wash. They do acetone wash on it. They're rinsing it. They're bringing it through alcohol wash. There's no supposedly living cells in there anymore, right? It's just the inorganic component of bone. But can the inorganic component of bone be transferring something?
Yeah, of course. Absolutely. That's what I've always worried about with cadaver bone, because I know that they're not testing it for anything.
Well, they'll test for HIV on the donors or whatever, supposedly, but they'll test for tuberculosis, supposedly. But there's been cases where knee surgeons have been using allograft bone and they transferred one of those terrible diseases. It's very rare, but it's happened. So, you start to sort of think, well, maybe we should be looking at alternatives to this. And so I've been, probably in the last 5 years, really been trying to use a lot of alternatives to that. Even bovine bone is possible, but again, bovine bone, you could be transferring mad cow disease. It's possible.
Yeah.
Right. And I eat a lot of deer meat. I hunt a lot, and I eat a lot of deer meat. You asked me about the antlers, and I eat deer meat. I'll eat deer meat before I eat any other meat in my house. We have muscle wasting disease, which is basically mad cow disease. We have it in the deer population.
Yeah.
And I've seen some in Minnesota. I've never seen one in Minnesota till last year, but I've seen a couple in Minnesota. They look like zombie deer. And I'm thinking, oh my, if you shot one and it looks like it's malnutrition and the fur is like comes off in your hands. Well, hey, I wouldn't even touch that deer, as they were right where it lied. But I would shoot it because I think it's transferring disease. So now I will shoot it even out of season if I see one, because that's not good for the deer population. But the fact of the matter is, what if you got one that's not really full blown yet and you're eating it? Could you be getting something? You could. But I think we can get so crazy with this stuff that we don't even have a life. I can't go outside and breathe the air. And then I see the chemtrails up there and I go, well, I wonder what that is. I don't know, and so I think we get carried away. I think the best thing we can do is keep our immune system strong. What's the best way to keep your immune system strong? Get rid of the toxicity, the most toxicities you can. Keep a good, healthy gut. Get rid of any. Get rid of the obvious toxicities that we can find. And in my case, it just happens to be mostly in the oral cavity.
Yeah.
Okay.
So Karl, one of the things that we always like to ask the people that we're interviewing is there a favorite injection that you do or an injection that you've seen make the biggest change? Now, I know you're probably limited in scope with your injections.
Yeah.
Can you give us a good history or a case that?
Yeah, well, I would, next time I see him, maybe the Frankenhauser would be good for me because, I've been drinking coffee all day and I'm about ready to pee my pants. But anyway,
I would say that you definitely want to pee before we Frankenhouse you.
I actually, after Ralph, remember Ralph Alzheimer?
Yeah, I love him.
I love him too. He's a great guy. I injected myself for the prostate from the frontal approach, but I sort of got scared and I won't do it again.
Good call, Karl. I think getting scared is the right approach to that.
Yeah, but I'm a little embarrassed to, you guys do it on me too.
Draping goes a long way.
Yeah. But no, my scope is limited somewhat. But I would say probably the biggest bang for the buck, because I'm doing it on a daily basis, is those tonsillar regions in the posterior superior alveolar. I'm right there, and I've seen people just, wow, whatever you did yesterday, that took care of it for me. The superior posterior alveolar. But I approach it from the oral cavity because it's just. We do that injection to numb some people sometimes, so it's a common injection for us.
Yeah.
Track back here and get up there. Of course, go through the head. Germans love to shove a lot of stuff right through the skull and stuff. That sort of scares me too a little bit, but I've done it. But I prefer to do it intraorally, and a lot of doctors don't want to do that because they're uncomfortable doing it orally.
Yeah, that's definitely your domain.
Yeah, so it's but I would say those two. Stellate ganglia. Your dad has tried to teach me that. Perry tried to teach me, and then Perry taught me a different approach. And so then when I'm trying it, no, this ain't right, Whereas your dad and Ralph taught me a different approach, and I felt more comfortable doing it that way. And then Perry shows me another way, and I'm going. And I tried it on somebody, they didn't get the droop, and I'm going, okay, I don't think I even get this thing. I don't know. So I need more. That's why I keep coming to the trainings. I need to feel a little more comfortable, and I need to when you guys are doing classes out there or something, I need to know when they are. I would love that on the NAANT that is very clear. Jeff Harris is doing a course, or you're doing a course, or whatever. So ahead of time, so you can plan ahead of time, because I can't go to everything. But I think that you guys will see me a little more on the West Coast. because both Jeff's there and you're there. And I just need to feel more comfortable with some of these, and I know you guys do this stuff day in, day out. And so I have actually treated friends in the lumbar region, but that was after one of Ralph's
You are not the first person to do that as a dentist.
Yeah. And oh, my wife had a sciatica problem. We were down in the islands in the Caribbean, and I happened to bring a bottle of Procaine with. I carry one with me now, especially when I go to Africa or something. And so I said, "Well, honey,
this is what you got.
Lay on the bed." And I shot her up, and I got rid of it Felice for a period of about a week and a half. She didn't have any symptoms, But then it started coming back again. I think it's more of she works out pretty good. Always some pretty good condition works. If you ever meet her, you'll like her. She's from Poland.
I did get a chance to meet her in Canada when we met the board meeting in Canada.
She's very direct. If she thinks you're a dumbass, she'll tell you right to your face, you're a dumbass. And she doesn't know English second language to put it any other way. So, a lot of people think, your wife doesn't like me. I said, yeah, you're going to know if my wife doesn't like you. Okay? She's not going to keep it a secret. And so, no, my wife, she's okay with it. Well, she just her nature. She's just very direct, and that's how she is. It doesn't mean she doesn't like you. But
Carl,
she's pretty funny.
Okay, next, we have a couple more questions to get through. Oh my God.
We're close, Carl. We're close. You're doing great.
What inspires you the most about medicine or dentistry or neural therapy? Or all the three?
I think, I'm still working. I don't need to work. Now I'm a lot of what I was telling Alana. We're building Matuni came up and said hi to me right when it started this. But we're building an orphanage, or we built an orphanage, and now we're taking in these orphans. At this point, I'm sort of working for them. In a sense, I don't need a whole lot of money myself anymore. I think I finally hit the spot where I'm okay financially, where I could live the rest of my life very comfortably. But I think I still have value out there. I'm still cognitively up and have some skill levels where I can teach people and still help patients. And so I come in on my day off. In fact, I'll be here tomorrow morning. Now, that's a whole other story because I got a lot of broke friends. I got a Polak that came up from Chicago today, brought a bunch of Polish sausage and Polish goods from Chicago, and he came up and did an impression, going to put a crown on him. Polish and Russian people are all pretty much the same. What's the deal? What kind of deal can I get? I'll pay you cash. What kind of deal? I can't really do those patients when I got a business partner during normal hours. Or my sons, one just left a message for me just now. They can't afford normal dentistry. I just say guns, old bullets, motorcycle parts. I take it all in trade. It doesn't matter. I got a half a beef for putting in some implants on a friend of mine not too long ago. I got a half of it. He works for the American Beef Association, so he got me a half of a cow. I had to buy a freezer just to put the cow in.
That's like my freezer.
Yeah. So my cousin took care of him last week, and he says, "Well, you don't have any money." I said, "No, you don't have any money right now." He says, "You got ammo?" How are you on ammo? I'm like, "I always use ammo." And he says, "Okay, I'll bring you a couple thousand rounds of 223." But I think I'm doing it because it's helping people, Ann. Just like what you're doing. We're helping people. What's our purpose in life? You get to this point of your life, and well, you guys are younger, but I'm to the point of life where what was it all about? Was it about a car? No, I drive a Toyota pickup truck. I don't care about having a Ferrari. It never interests me. I do a lot of hunting and fishing, but I don't even have a fancy fishing boat. I got the old sit at the back of the boat, Okay.
On the lake every summer.
Outboard motor, I don't, could I buy it? Yeah, I could. But that kind of money could actually do something significant like, save 10 children or educate. We had 75 blind children at one time who were paying for their tuitions, $300 a year. I'd rather see that. I'm trying to stack the cards in my favor because I'm a recovering alcoholic and addict, and I wasn't always this nice. 25 years ago, you wouldn't even like me. You wouldn't have talked to me. And so I was out there destroying my life and destroying, myself, using, that stuff. And so I'm sort of, maybe trying to balance the scale a little bit. It's time for me to give back a little bit somehow in my life.
That's great.
I just earlier today, my youngest son, he died 9 times in the last 2 years of fentanyl overdose.
Oh, wow.
I had to do CPR on him 9 times. Well, I was just with him the other night. We gave him a 1 year off of fentanyl. That's not even heard of.
Yeah.
And if you work in the recovering community as long as I have, for 25 years. I've been in the recovery community. It's unheard of. There is no 1-year mark for heroin, and heroin may be a little bit. Heroin's a little easier than fentanyl, but that fentanyl is killing a lot of young people. And so I think that there again, who do I see on Saturday? Well, a lot of times I'm seeing some of those people because they don't have any money. And then if they go to treatment, they put them on Suboxone. Suboxone will rot the teeth right out of their head. I've never seen anything like it. It's worth them. We used to call meth mouth in the old days when people would smoke meth. They'd rot their teeth out. But no, meth comes from the outside and goes in. Suboxone comes from the inside out. It's just bizarre. I mean, their teeth just rot right the hell out. So I'm seeing one of those tomorrow.
So it sounds like your inspiration is really about giving back and, to your community.
Helping people. I mean, what's the purpose in life? I mean, I've been blessed. You guys don't know this about me, but I've raised 7 children. Okay. And then I've got the adopted girl, 8 in Africa. Then I've got the orphans, and now we're up to 6. I've just been very blessed for some reason. I don't know why. It's not like I really wanted the kids. I mean, I was 17 years old, for crying out loud. I didn't want any kids. I just wanted sex. You start having kids, you can't.
One does lead to the other.
You can't throw them back in, and so you do the best you can.
So, Karl, can you tell us how people can find you?
Do you have a website, Karl?
Yeah. Do you have a website?
Oh, yeah, I have a website. I do have a website. It's called www.toothbuilder, TOOTHBUILDER, toothbuilder.com.
That's a good one, actually.
I like it.
So that's a good place to.
That's almost as good as our learnneuraltherapy.com.
Yeah, I say when you can find me. I mean, okay, you can find me in Kansas about 4 times a year, or you can find me out at Sturgis if I go. I'm thinking I'm going to go to Sturgis this year again. You can find me Great Lakes. I'm taking my younger grandsons up lake trout fishing in May. And then
but really, for dentistry, we could find you in St. Paul.
At toothbuilder.com. Yeah.
Cool. Okay.
And the other doctor, my partner, is Cassie Yang. Cassie Yang, you've met her. She's an Asian gal. Yeah, Cassie. She practices with me when she's not goofing off. She goofed off this week. Her kids, she has younger kids, so they had school break, and so she didn't come in. And Jack is now a young up and coming guy that's he's going to be good. He's very.
Everybody's doing your type of dentistry, your biologic dentistry.
Yeah, our whole practice. We can change patients interchangeably. What happens, unfortunately, is a lot of the doctors know me, and so they say, "No, you can only see Dr. Karl," and I'm trying to wean them off a little bit so I can take more time for myself. Because my ideal, hopefully by the summer, is take a little more time off for myself. I get burned out. This week was really a tough week for me.
How old are you, Karl?
I'm 69.
69. Good job.
Yeah.
We really want to thank you for coming on and answering all of our unanswered questions about dentistry, because it is so important for the anatomy of health. And I don't think many people are as well versed or as good at you as in understanding the underlying causes of what non-biological dentistry can do. So we just really want to appreciate, after a long work week where you were covering everybody's schedule and, you're doing the fundraising. So we really appreciate you taking the time and talking to us and just talking about this really important field of dentistry that's growing because of you giving back to it, actually. So thank you.
Yeah. Well, I appreciate the time, man. You guys possibly don't know how much I admire you. Okay. See, I do something that's very easy and monetized. That's what I always tell Jack. One thing that's great about dentistry is we can monetize what we do. Okay. Functional medicine docs, naturopathic docs, it's a little harder to monetize it. You charge for a consult, you charge for this, you charge for that, but it's not the same as what we do. I mean, we could ding, 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 ding. You got this list of things that we do, and we can make it's sort of like I say, it's almost sort of like, I can't believe it sometimes, from when I started to what things cost nowadays.
Yeah, it's so much more these days. Yeah.
How long it takes me to do that one thing that I might get $3,000 for, it's almost embarrassing. I mean, that's why I'll do a lot of free stuff to pay back, because I feel a little bit like it's a little obnoxious, to be honest with you. But that's also why I think that if you I think I instilled in Jack a little bit. Cassie pretty much, if she's going to work, she's going to pay, she's going to charge. And that's okay. The person has the right to do that. I sort of feel like, when we're making really good money, we have to give back to, if we have the little old lady that's on Social Security, my God, take care of the old lady, I mean, I lie to them all the time. Well, I want to pay you for this. Gosh, it's going to be $25 for something that might have been $500. They're living on a fixed income, or that kid that mom has to deal with, a child with autism. I mean, we can knock some money off on that stuff and just try to help. And so that's very rewarding about my job. But you guys are doing the same kind of thing. It's just that I think that it's harder to monetize. I mean, think about functional medicine. You're doing all these tests and everything, trying to analyze all these tests and trying to get that, pure functional medicine practice. I mean, I haven't seen many of them that are making, really great money. So it's not we're doing this for the money.
Yeah.
We're doing it for some other reason, right?
Nobody becomes a naturopath because they want to make a lot of money. That is absolutely for sure.
You're doing it because you have a passion for naturopathic medicine. You have a passion to help people. And we are doing it. And really at the bottom line at the end of the day, what's it all going to be about? That's all it's going to be about. Nobody's going to talk about your car when you leave planet Earth. Oh man, he drove a really cool car. Or in my case, a motorcycle. Oh yeah, really cool. I've had a couple of nice motorcycles. I gave them away. But I do still have two of them. But they're not going to say stuff like that. What they're going to say is, man, this person was a good guy. They helped me out. It's our purpose. Right? So I think we got to back up. In our fields, we have a blessed way to bless other people. What greater thing can we do?
It is.
No, you guys don't realize how much I appreciate you.
Well, thank you.
You got an unbelievable father.
I agree. I won the lottery being born. That's what I always say.
Yeah. Well, So are we off air now?
Nope. But let's say thank you. Thanks, everybody. Thanks for joining us today. If you like the episode, please like and subscribe to our channel and review us on your podcast players. Also, if you think this episode is helpful to some of your friends or colleagues, please share it widely. If you are curious about learning about neural therapy or other injection techniques, check out our courses on learnneuraltherapy.com. We'll see you next month for our next installment of the Point of Medicine podcast.